Good morning, communicators! Listen up, communicators. Listen up. Ay, pang parkong pala yan. So, good morning, guys. My name is Deliberative. I will be presenting this presentation about uh, the nursing process of Ida Jean Orlando. Okay, next slide. Now, I have 5 agendas. First is the biography of Ida Jean Orlando. Second is the education. Saan nga ba siya nag-aral si Ida Jean Orlando? Ano nga ba yung tinapos niya? At ano yung mga edukasyon na honorary na ginawa niya? And then the third is paradigm. How important it is to our nursing mga students. And the fourth is the concept of this theory. Saan nga ba napapalagay ang concept nitong theory ni Ida Jean Orlando? And then the fifth is the strength and the weaknesses of his theory. Next slide. So ano nga ba ang talambuhay ni mga biography ni Ida Jean Orlando? Ida Jean Orlando is born on August 12, 1926 to November 28, 2007. Ida Jean Orlando was an American nurse researcher, theorist who has made significant contribution to the field of nursing. She was born in New York City and grew up in a working class family. Orlando graduated from New York Medical College School of Nursing in 1947 and earned her BS in public health nursing from St. John's University in 1951. Orlando is best known for her nursing process theory, which emphasizes the importance of the nurses to patient relationship and the role of the nurse in meeting patients' immediate needs. Her theory focuses on nurses' response to the patient's needs rather than the patient's needs themselves. Orlando believes that nurses must use their own perceptions, feelings, and thoughts to identify the patient's immediate needs and respond appropriately. So si Ida Jean Orlando ay kilala bilang sa nursing process theory niya or the deliberative nursing process theory, which ay naka-emphasize sa nurse to patient ng relationship na ito. So, next slide. Orlando worked as a staff nurse at the New York Medical College and as a nursing instructor at Yale University. She later served as the Director of Nursing Research and Education at the Medical Center and Hospital Vermont. Orlando conducted research on the nurse-to-patient relationship and published several books and articles on her nursing process theory. Her most famous book is The Dynamic Nurse-to-Patient Relationship, Function, Process, and Principles, which has the first published 1961, and it remains the classic in the field of nursing. Did you know that Orlando's deliberative nursing process theory has been influenced in nursing process practice, education, and research? This has been adapted into various nursing frameworks such as clinical decision-making model and has helped the shape of contemporary nursing practice by emphasizing the importance of individualized patient-centered care. Throughout her career, Orlando received numerous awards and honors for her contribution to nursing. She was inducted into American Nurses Association's Hall of Fame in 2000, and she was awarded an honorary doctorate by the University of Kentucky in 2003. And sadly, Orlando died in 2007 at the age of 81, leaving behind a lasting legacy in the field of nursing. Next slide, please. So the next is the education of Ida Jean Orlando. So Ida Jean Orlando received her education in nursing from several institutions. She has begun her nursing education at New York Medical College, where she earned her diploma in nursing in 1947. She later earned a Bachelor of Science in Public Health Nursing from St. John's University in 1951 and a Master of Arts in Mental Health Nursing from Columbia University in 1954. Orlando's education and training in nursing, public health, and physiology earned her development of a nursing process theory, which emphasizes her importance of nurse-to-patient relationship in addressing patients' immediate needs and response. Interdisciplinary approach to nursing process has been influential in nursing practice, education, and research, and continues to be a major focus of study for a nursing student and professional. So, ang pagiging public health and physiology ay naging development sa kanya upang bigay importance ng nurse-to-patient relationship niyang kanyang theory na kanyang ina-address. So, in addition to her formal education in nursing, Orlando also pursue an additional training in physiology and psychoanalysis. She studied at the William Alanson White Institute of Physiotherapy and Physiology and Psychology in New York City and completed a 2-year training program in psychoanalysis. Next slide, please. So, the paradigm of Ida Jean Orlando. Ida Jean Orlando's nursing theory is based on a humanistic paradigm that views the patient as a unique individual with a unique needs and responses. Orlando believed that nurses must focus on the patient's immediate needs and work to develop a personalized care plan that addresses those needs. So Orlando's paradigm is focused on a nurse-to-patient relationship, which she believed has essential to providing a quality care. She emphasizes that the importance of nurses building trust with the patient, listening to the concerns and responding to the immediate needs in the truthful and deliberate manner. Oo nga naman, kailangan nagbibuild ka ng trust sa iyong patient. Hindi kunyari, ay, sir, mag-inject po sana ako ng gamot sa inyo. And then, sabi ng patient, oh my gosh, baka ano yan ha? Then, may parang walang trust yung patient sa kanya. Orlando's paradigm is grounded in the belief that is the patient's behavior from a form of communication can that be interpreted by the nurses. The nurse's interpretation of the patient's behavior guides the nurse's process and the development of planned care. Orlando believed that the nurse's perception of the patient behavior is influenced by their own perceptions, feelings, and thoughts, and that nurse's response to the patient's needs must be based on their own understanding of the situation. Orlando's paradigm is also focused on the importance of communication in the nurses to the patient. Relationship relationship. She believed that effective communication between the nurses and the patient is essential to development of a therapeutic relationship and for the meeting the patient's immediate needs. Orlando emphasizes the importance of the nurse's use of language, tone, and nonverbal cues to convey empathy and understanding of the patient. Next slide, please. Okay, and then this is the Indogene Orlando's concept to based on his theory, nursing process theory. And then one of the key concepts in Ida Jean's Orlando's nursing theory is the nursing process theory, which is based on the idea that nursing is interpersonal process between the nurse and the patient. According to Orlando, the nurse's primary role is to determine the patient's needs to provide interventions to meet those needs. This process involves these three stages, which is the assessment, diagnosis, and the interventions. Which, ano nga ba yung ina-assess? Assessment natin. This stage involves gathering information about the patient's needs through observation, conservation, and examination. The nurse identifies the patient's immediate needs and any factors that may be affecting their well-being. So, the diagnosis. Dito na, pagkatapos ng assessment, dito na papasok ang diagnosis. Based on the assessment, the nurses identifies the patient's stresses, which is defined as the feeling of discomfort or helplessness. The nurse interprets the patient's behavior as a form of communication and determines the nature of the distresses. So the next is the intervention. Yan yung pinakalas. Intervention, the nurse develops a plan of care to address the patient's distresses and meets their immediate needs. The nurse uses their knowledge, skills, and resources to provide the patients with the necessary care and support. So, ito na nga ang strength and weaknesses ng theory about Idagene's theory. So, a strength ng theory ni Idagene Orlando. Orlando's nursing theory emphasizes the importance of nursing, of nurse-to-patient relationship, and the nurse environment in the patient's care. And then her theory focuses on the patient's distresses as the central focus of a nursing care, which aligns with the holistic approach to nursing, which is good to the nursing process. And then Orlando's theory provides a structured approach to the nursing care that guides nurses in assessing and meeting the patient's needs. And the last, her emphasizes on effective communication and nurses' perception of patients' behavior as a form of communication relevant in the current healthcare environment. Which is very good naman na nurse-to-patient relationship niya, which is. And then, the weakness of this theory, Orlando's theory. Orlando's theory does not address a cultural and social context of the patient, which may limit its applicability in diverse healthcare settings. Some critics argue that Orlando's theory is too focused on the immediate needs of patients and does not address the long-term health outcomes. And then the theory does not provide clear guidelines on how to measure effectiveness of nursing interventions. And then the theory may be challenging to apply in the situations where the nurse to patient relationship is a compromise, just as an acute care or emergency settings. In the summary of Ida Jean's Orlando's deliberative nursing process theory emphasizes that the importance of nurses' response to a patient's needs and nurse-patient's relationship. That the theory emphasizes the importance of nursing process and the nurse's environment and the patient's care. Orlando's theory had a significant impact on the nursing field and continues to be a widely used framework for nursing practice. So, halos maganda naman lahat ang nursing process theory ni Ida Jean Orlando. Medyo nga lang sa guidelines and long-term addresses niya, dun tayo nagkakatalo. Pero maganda naman ang holistic approach and clinical process involve the assessment. Meron nga siyang diagnosis, planning, implementation, and evaluation. Na nag-start sa nurses' perception to the patient's behavior, followed by an analysis of the behavior of the determine the patient's needs, which is maganda naman sa theory ni Ida Jean Orlando. So, yun na nga. Thank you guys. Thank you for watching. Please like and subscribe. And goodbye.